Dear colleagues, it is a great pleasure to welcome you to the second day of CPPS TREX World Patient Safety Day 2022 that will be held from 21 to 23 September 2022. Through this event, we need to build a community understanding and awarenesses to make safety in general as a primary goal for all healthcare providers. In CPPS TREX Patient Safety Day, it will be 3-day comprehensive free activities, which are designed to be a one-of-a-kind knowledge sharing event and a real opportunity to learn and network. The aim of these sessions in this event is to raise the awareness of need to adopt a systematic approach to improve the medication safety and promote safe medication practice in our facilities. This to prevent the medication error, which is considered as a third leading cause for death in the United States and accounts for up to half of the overall preventable harm in a medical care. So we need to build a culture of medication without harm, take action to save lives no matter who you are. We need to reach to zero harm is the only acceptable goal. So we need to unite for medication safety to be as our pledge in our facilities. Today, we will start the first session today. We already have 2 sessions in this day. The first session in this event, we will start by Dr. AMAL BAGALB. Dr. AMAL BAGALB is a baccalaureate degree of pharmaceutical science, 21 from King Saud University, a certified medication safety officer, head of medication safety unit at King Saud Medical City, Riyadh First Health Cluster medication safety lead. Welcome, Dr. AMAL. Thanks for your commitment to participate in this event and sharing your knowledge and experience. We will hear today to the lecture under the title Medication Without Harm, the challenges and obstacles in the journey of its achievement. تفضلي يا دكتورة.
Thank you, Doctor, for your introduction. Good evening, everybody. Let me start by saying that it's a great honor for me to be here today, and I would like to thank the Patient Safety House for giving me this chance to present my topics. Okay. Today we are talking about one of important topics that was witnessed recently and every year. Our topic is medication without harm. For today, we will give you the overview regarding the World Patient Safety Day and about the objectives, challenges 2022 for the World Patient Safety Day, strategic of framework, and the last one as we are talking about the key action areas. During 2019, the World Hospital the WHO was established to be and fixed the annual date to be global action on the patient safety to be on the 17th September. For that, they have when we start to talk about the World Patient Safety theme during 2019 to up to 2022. 2019, the main goal of the Patient Safety Day is speak up to the patient safety. That's mean they need to make a good communication and about to take the consideration for the patient safety. The second year, in the date 17th September 2020, they speak up for health worker safety. In the September 21, they act now for safe and respectful childbirth. This year we have the theme of the word patient safety, as mentioned previously, for the medication safety, and the slogan is medication without harm. When we said why we need to take consideration about the medication without harm, the medication-related harm represents around 50% of all preventable harm in the medical care, with prescribing and monitoring errors contributing to the highest source. Also, the research is estimated that medication error affect at least 1.5 million people every year, and cost the healthcare system between the $77 billion to $177 billion US annually. Another study revealed that around 1.3 million people are injured by treatment intended to help them, and misuse of medication was leading cause of medication errors. We will be going to know the globally cost associated with the medication error has been estimated around $42 billion annually. So the error could be happen in every stage of medication use process. The medication error occurred due to some factors or some weak medication system or human factors such as fatigue. So the goal of the challenge of the world patient safety is reduce the level of severe avoidable harm related to the medication by 50% over 5 years globally. So the main objectives of the World Patient Safety Day is, or the Global Patient Safety Challenge on the medication safety, will facilitate a strengthening of systems, practices that can initiate corrective action within countries to improve patient safety and decrease avoidable harm to the patient. In order achieve our challenge, they focus or will adopt in the 4 specific objectives. Number 1, raise all the global awareness of the high burden of medications related harm to medication error and unsafe practice, and advocate an urgent action to improve medication safety. The second objective is engage the key stakeholders and partners in the efforts to prevent medication errors and reduce medication-related harm. Also, empower the patient and families to be actively involved in the safe use of medication. The last one is scale up implementation of WHO Global Patient Safety Challenge, the medication without harm. So the Global Patient Safety Challenge has developed a strategic framework or shaping the challenge include or that identify to be work in the 4 domains of the challenge. First domain is to work on the patient and the public. The second one, healthcare professionals. The third, medicines and system practices of the medication. So this strategic framework for this challenge should galvanize commitment to reduce medication errors and medication-related harm, and strengthening measures and safety monitoring system. Also, these 4 domains was categorized into subdomains to be worked on it. For the first domain, they were talking about the patient and public. Patient and public are not always medications wise. They are too often made to be passive recipients of the medicines, are not informed and empowered to play their part in the making the process of medication safer. working for the patient or focus the patient and public. That's mean they need a public awareness or medication literacy, engagement of the patient, reporting by the patient for any incident that happened, involvement of the patient in the organization. The second domain is talking about the healthcare professionals. Now we are first focused on the patient. Now about patient and public. Now we focus on the healthcare professionals. Healthcare professionals need more or sometimes prescribe and administer medicines in way and circumstance that increase the risk of harm to the patient. That means it needs more education and training, increase the communication and teamwork, capability at point of care, incident reporting to and take this incident for the learning lesson for all health providers. For the third domain, they're talking about or take care about the medicines and system. Medicines are sometimes was complex and can be puzzling in their names, packaging, and sometimes lacking or lack of sufficient or clear information. As you know, for example, the confusing or lookalike sound alike medicines named and or labeling, packaging are frequent sources of error, and medication harm can be addressed if we make a strategy to prevent and take care about right product at the point of care, logistics, storage, and disposal, naming, the labeling, and the packaging. Also take care about the product quality and safety. The fourth domain is talking about the systems and the practice of medication. The system and the practice medication are complex and often dysfunctional and can be made more resilient to risk and harm if they are well understood and designated. Actually, the systems and the practice of medication has complex and sometimes need more support and from the leaderships, also governance. We need to take care about the systems or practice during the good system during the medication management cycles, prescribing, preparation, dispensing, during the administration and the patient monitoring, also monitoring and evaluation. Now we are going to the third part of our lecture, which is talking about the action taken area or key action area. The key action area, this action embraced by the challenge into three category action area. Medication without harm. Health services are encouraged to take action and prioritize medication safety across the WHO's three flag area. First area is polypharmacy, monitoring the polypharmacy and responding to inappropriate polypharmacy. The second one is reduce any harmful for the high risk medication. The third one is improving medication safety at transition of care. So early priority action for they can ask the countries or community and key stakeholders to make a strong commitment, prioritize and take early action and effectively manage three key areas to protect the patient from harm. We are going to talk about the first area, the medication safety in the polypharmacy. Polypharmacy is often defined as routinely taking a minimum of 5 medications. That's mean routinely in the day. Could be OTC medication or other medication, routinely, not as a chronic or as a treatment. This is routinely taken. Ensure the medication safety in the polypharmacy is one of the key challenges for medication safety today, due to traditional focus, both medical researches or healthcare delivering modules on the single disease interventions. There has been notable lack of evidence. The studies conducted in many countries have estimated the rate of the medication error both in hospital and in general practice. One study they mentioned or found when the patient received 5 or more medication had a prescribing or monitoring error rate, medication error rate reached to the 30.1%, while the patient who take 10 or more medication that could have medication error rate could be reached 47%. This is demonstrating that the medication error increase with the number of medicines prescribed for the patient increase. Another study conducted across 8 countries found that the incidence of the patient reported errors increased with the number of medication that were taken. So the polypharmacy may have a harmful implications for patients, such as increased risk of medication error, drug-drug interaction, suboptimal patient adherence, reduced quality of life. There is a key steps to ensuring medication safety implementation in the polypharmacy, starting by appropriate prescribing and risk assessment, good or close medication review for the patient, implementing medication safety during the dispensing, preparation, and administration, enhance the communication and the patient engagement. Also, take care about the medication reconciliation at the transitions care. The second key is the medication safety in the high risk situation. High risk situations are important. It's important because they are more often associated with significant harm due to unsafe medications practice or medications error. There's contributed factors related to the high risk situation or medication error. In this case, could be due to medication or due to providers and patient or systems factors. The factors related to the medicines include the use of high-risk medication as high alert medication, often medicines with low therapeutic index. When do like that, this will because increase the incidence of high risk if we not implement the medication tips during this process. Also, the provider, regarding the other contributing factors, provider and the patient, include use, maybe related to the, could be a healthcare professional providing patient care or to the patient being treated. So we have two here, even by the healthcare provider or the patient. For example, poor prescribing practice by healthcare professional include over prescribing. The under-prescribing sometimes could be, or mis-prescribing like omission. However, error may occur at any stage of medication process, include dispensing and administration. Third, contributing factors that can affect medication safety in high-risk situation is systems factors, work environment. Include settings such as the hospital and the high-risk situation. Within those settings, risk associated with the preoperative or neonatal or any critical or high-risk area. Medication error could be caused a combination between these factors, medication or provider, patient or systems factors. The range of sustainable strategies to preventing the error should be mandated and should be developed and implemented in conjunction. This strategy form is a part of a system approach to reduce a risk of medication error, supported by strong safety and reporting culture, alongside education or on-site education and feedback. The third key area that we are talking today about it is medication safety in transition of care. Transition care is care for when a patient moves between facilities, sectors, and also between on the staff members. For example, we have a transfer from emergency room to the intensive care unit, or a nursing home to the hospital. That will be, or from primary care doctor to the specialist. So this is change from area to areas, also between the staff of the hospital or professionals. This sometimes during transferring the shift change could increase the possibility of communication errors, which can lead to serious medication error. So the patient are at increased risk during transition of the care, and seriously mistakes can do. So at this transition care, we have medication safety strategies to improve the medication safety during this transition of the care. One of these the strategy is implementing a formal structured process for medication reconciliation at all transition point of the care by taking or implement a formal structural process by building the best possible medication history by interviewing to the patient and verifying the list of medication, reconciling or update the medication list, communication with the patient and the future health care providers about changes in their medication where agreed rule and responsibilities, training, support and professional of the tools and technology. Another strategy is key for improving medication safety during a transition of care is partnering between patient families and caregivers and healthcare professionals to agree the treatment plan, ensure patient occupied to manage their medication safely, and ensure the patient have an up-to-date of the medication list. Improve the quality and availability of information at transition care, improve implementing collaborative medication management between the medical and nursing and pharmacy personnel. So for improving improving and implementation collaborative, we need to make a good education and the good reviewing of the medication and implement what does it know all of you, medication reconciliation and review. The medication reconciliation, one of the important process during the transition care. It is a formal process in which healthcare provider professionals partner with the patient to ensure accurate and complete medication information transfer at interfaces of the case. The pharmacist role in this medication reconciliation is very important. They can stop the drug interaction. They could stop any duplication of the orders, any duplication of the drug. Also, they can stop for inappropriate medication or not match the medication with the history of the patient or diagnosis of the patient. Any medication discrepancy refer to any difference between the medication use history and admission medication is order. So we are suffering sometimes from any discrepancies that could be catch or preventing during make a formal process that's name is medication reconciliation. Our lesson today, for today, this is the last slide, and I have a lesson to learn from our lecture. Ensure the medication safety is addressed at the levels and in all settings in the healthcare system. Anyone or any patient, they taking high-risk medication, this is indicated it's high-risk patient. So take care about that type of the medication. Try to put and create the place strategies to reduce the risk of medications errors, such as double checking, patient engagement, and use information technology to improve the process. Everyone has a role in reducing the incidence of the medication error through reporting the incidents, to take the learned lessons, through verify and review all the process or publication or any orders that could be due. Thank you.
Thanks, Dr. Amal, for this brief and valuable lecture in this in our activity for raising the awareness for regarding education safety. We need to ask if anyone need to ask Dr. Amal for anything. Any questions, please? Anyone need to ask Dr. Amal can open the mic direct. No one need to ask anything. Okay,